Hey everyone, ready for another deep dive?
Always. Let's do it.
Today we're tackling weight loss surgery.
Ooh, interesting.
We've got all sorts of sources. We've got some US government health info, some articles from, what's it called? An Australian health insurance company,
Oh, okay.
and even like patient education materials.
Yeah.
So we really wanted to like give you the whole picture
Yeah, that makes sense.
so you can, figure out the different types of surgeries, who might actually be a good candidate, all the benefits, the risks.
The good, the bad.
Yeah, and the lifestyle changes, the super important stuff.
Definitely.
So by the end of this, you'll be a weight loss surgery expert.
I love it.
So, first things first, let's just back up.
Okay.
What even is weight loss surgery, and
Right.
how does it actually work?
So weight loss surgery, sometimes it's called metabolic surgery or bariatric surgery.
Right.
It basically involves making changes to your stomach and your digestive system
Hmm.
through surgery, of course. And it's really all about limiting how much you can eat
Okay.
so you can lose weight.
That makes sense, but I feel like it's not like the first thing people try,
Right.
really.
It's definitely not a first-line treatment.
Yeah.
Usually considered after people have tried other things like, making lifestyle changes,
Okay.
maybe taking medications.
Uh-huh.
And those haven't really been successful.
Got it. So, who would be a good candidate if they were thinking about weight loss surgery?
Well, there's some guidelines to help figure that out.
Okay.
The NIDDK, so that's the National Institute of Diabetes and Digestive and Kidney Diseases, they have some guidelines for adults.
Oh, wow. That's a mouthful.
It is. They basically say that if you have a BMI of 40 or higher,
Okay.
weight loss surgery might be an option for you.
So, for people who don't know, BMI stands for...
Body mass index.
Right. Yeah.
Yeah, and it's just a measure of body fat based on your weight and your height. Now, even if your BMI is a little lower, like 35 or higher,
Okay.
but you also have some health issues related to your weight, like type 2 diabetes, heart disease, sleep apnea, things like that,
Mm-hmm.
then surgery might also be something to think about.
So, it's not just about a number, it's about what your weight is doing to your health.
Exactly. It's the bigger picture.
Yeah.
And there's one other situation where they suggest considering surgery,
Okay.
and that's if your BMI is 30 or higher.
Okay.
And you have type 2 diabetes that's hard to manage,
Okay.
even with medication and lifestyle changes.
Got it. Now, what about teenagers?
Right.
Is that like a thing?
It is, yeah. It can be an option for teenagers, too.
Okay.
Similar to adults, they also recommend a BMI of 40 or higher,
Okay.
or a BMI of 35 or higher, but with those serious weight-related health problems.
Okay.
The big difference, though, with teenagers is that it's really important for them to be evaluated by a team of specialists.
Oh, that makes sense.
Yeah, with expertise in pediatrics.
So it's like a more individualized decision for them.
Yeah, you have to think about their development, too, and their growth.
Totally.
But I think the most important thing to remember is that regardless of your age, this is a big decision.
Right.
And you really need to be prepared. Do your research.
Totally. Speaking of being prepared, I was reading through the NIDDK materials, and they had this list of like questions
Oh, yeah.
for people to ask themselves if they're thinking about weight loss surgery.
I love that.
Yeah, I thought it was really good.
Yeah.
Should we go through those?
Yeah, let's do it.
Okay, so the first one is, have you actually tried to lose weight in other ways?
Right.
Like, have you changed your lifestyle? Have you, tried medications?
And it hasn't worked.
Yeah.
Or you've lost weight and gained it back,
Right.
which happens a lot, too.
Right. It's like a reality check.
Exactly.
Okay, so the next one is, do you understand like what the surgery actually involves?
Right. The good, the bad, the ugly.
Yeah, like all the risks and the benefits and all that.
Exactly.
Okay, and then this one is, do you understand the lifestyle changes?
Right.
Like how you're gonna have to change how you eat and exercise and everything.
Long term.
Yes.
Forever.
It's not a quick fix.
No, it's not.
Okay, and then this one's kind of like goes with that, which is, can you commit to those healthy habits?
Yeah, that's the $1,000,000 question.
Yeah, because it's a lot. It's you have to be really dedicated to it.
Yeah, consistently eating healthy foods,
Right.
staying physically active, keeping up with your medical appointments,
Yep.
taking vitamins and minerals.
Well, that's right, because you can have deficiencies, right?
Yes, you can. Yeah, because your body doesn't absorb nutrients in the same way after surgery.
Got it.
So you really have to supplement.
Okay, that's important.
Yeah.
And then the last question they have here is, Have you thought about the cost?
Right, the financial side of things.
Yeah, because it's not just the surgery, it's like the follow-up care and all
Yeah,
that. So
definitely.
it's good to be prepared for all that.
Yeah, definitely. So, okay, we've talked about like how weight loss surgery is a big decision,
Is.
but let's say you've thought about it and you're like, okay, I want to learn more.
Right.
What are like the most common types?
Well, the most common one is the gastric sleeve.
Okay.
Our Australian source and the patient education materials both agree on that one.
Okay.
And basically, that's where they remove a large portion of your stomach
Uh-huh.
and they make it into like a smaller tube-shaped stomach.
So you just physically can't eat as much.
Exactly.
Well,
Yeah. The second most common one is called Roux-en-Y gastric bypass.
ooh, that's a mouthful.
It is, yeah.
What is that?
So that one's a little more complex.
Okay.
Basically, they create a small pouch at the top of your stomach,
Okay.
and then they connect that pouch directly to your small intestine.
Bypassing a portion of your digestive system.
Okay.
So it restricts your food intake and changes the way your body absorbs nutrients.
Wow. That's pretty fascinating.
It is.
Are there any other types besides those two?
Yeah, there are a few others, but they're not as common.
Okay.
Um, you might have heard of the adjustable gastric band.
Oh, the lap band.
Yes, the lap
Yeah,
band.
I've heard of that one.
So that involves putting an adjustable band around the upper part of your stomach,
Okay.
and then they create a small pouch above the band,
Okay.
and they can adjust it over time to control how much food passes through.
I see. Why isn't that one as popular anymore?
Well, our Australian source actually mentions that it has a higher failure rate.
Oh, really?
Yeah, and more long-term complications compared to the other procedures.
That makes sense.
Yeah.
So what about like some of the lesser known ones?
Okay, so there's one called biliopancreatic diversion with duodenal switch,
Oh my gosh.
which is a mouthful. So they call it BPDS for short. And it's a two-part procedure. So first, they remove a large part of the stomach, similar to the gastric sleeve,
Okay.
and then they bypass a portion of the small intestine.
Okay.
It's a major surgery, and it's usually reserved for people with really severe obesity.
Got it.
Um, there's also something called gastric plication, which is another restricted procedure.
Okay.
They basically fold the stomach wall in on itself to make the stomach smaller.
Okay, so lots of different options.
Yeah, lots of options.
So we know weight loss is like the main goal,
Right.
but are there other like benefits to having weight loss surgery?
Oh, yeah, there are so many benefits that go beyond weight loss.
Really? Like what?
Well, a big one is that it can improve or even resolve a lot of medical conditions that are related to obesity.
Oh, that makes sense.
Yeah, like type 2 diabetes.
Oh, wow.
It can have a really significant impact on type 2 diabetes.
So it can help manage or even like reverse it?
In many cases, yeah.
Wow, that's amazing.
Yeah, it can also improve or resolve high blood pressure, heart disease, sleep apnea,
Wow.
even unhealthy cholesterol levels.
Okay, so it really does tackle a lot of things.
Yeah, it does.
That's fair.
It can also help with things like urinary incontinence and joint pain,
Oh, wow.
especially in the knees and hips.
So it's not just about like looking different.
Right.
It's about feeling better too.
Absolutely, yeah.
Okay, that's great.
And here's a really big one. The NIDDK says that for people with severe obesity, weight loss surgery can actually increase their lifespan.
Wait, it can help people live longer?
Yeah,
That's incredible.
it is.
So it's like a really, really beneficial procedure for a lot of people.
Yeah, it can be.
Okay, so beyond those like physical things,
Right.
are there like any other benefits?
Yeah, people often find that after surgery, they can move around easier
Oh, I bet.
and they're more physically active.
Yeah, because they don't have like the weight holding them back.
Exactly.
Yeah.
And then there's the mental and emotional benefits too.
Okay.
A lot of people report that they're happier.
Okay.
They're more confident
That makes sense.
after surgery.
Yeah.
And also, as you start to lose weight and your health improves, you might need fewer medications.
Oh.
So that can save you money in the long run.
That's a nice bonus.
It is.
Okay, so there are like a lot of potential benefits.
Yeah, there are.
But we have to talk about the risks too, right?
We do.
Because every medical procedure has risks.
Yeah, it's true.
So what are some of like the side effects that people might experience?
So the NIDDK breaks them down into short-term and long-term.
Okay.
So in the short term, right after surgery, there are risks of things like bleeding, infection, even leaks,
Oh, wow.
where the stomach or intestines were stapled or sewn together.
Okay.
Other short-term side effects can include diarrhea and blood clots in the legs.
Oh, wow.
But those are pretty rare,
Yeah.
thankfully. Now, in the long term, one of the big things is that your body might not absorb nutrients as well after surgery.
Oh, that's right, because we were talking about the vitamins and minerals.
Exactly.
Yeah.
Why is that?
Well, it's because the way your body digests food is literally changed by the surgery.
Oh, okay.
Um, so it's super important to take those vitamins and minerals
Yeah.
because not getting enough of those nutrients can lead to things like anemia, osteoporosis,
Okay.
also gallstones
Oh, right.
can form after rapid weight loss.
Oh, I didn't know that.
Yeah, so some doctors might prescribe medication to help prevent those for a few months after surgery.
That's interesting. Are there any other, like, long-term risks?
Yeah, so remember we talked about gastric bands?
Yeah.
One of the risks with those is that the band can slip out of place
Oh, wow.
or even erode into the stomach wall.
Yikes.
Yeah, and in those cases, they'd have to go in and take the band out.
Okay, yeah. That's why they're not as common anymore.
Exactly.
Is there anything else?
Yeah, strictures.
Strictures. What's that?
Yeah, so it's basically a narrowing of the new stomach pouch
Okay.
or the connection between the stomach and the small intestine.
Okay.
And that can make it hard to eat,
Oh, yeah.
especially solid foods.
Yeah.
And it can cause nausea, vomiting, problem swallowing.
Okay. So that's something to watch out for.
Yeah, but thankfully it's usually treatable.
Oh, good.
And then finally, hernias.
Oh, right.
Those can happen
Yep.
at the incision site or in the abdomen,
Yeah.
and they may need to be surgically repaired.
Okay. So those are like all things to think about.
Yeah, definitely.
Is there anything else we should mention from the sources?
Yeah, this one's interesting. The NIDDK, they talk about how weight loss surgery can change the way your body handles alcohol.
Really? How so?
Yeah, it seems that alcohol might be absorbed faster and have a stronger effect after surgery.
Oh, wow.
So it could mean an increased risk of alcohol-related problems.
That's definitely something to keep in mind,
Yeah.
for sure. And actually, speaking of risks, I think our Australian source mentioned that general anesthesia itself is riskier for people who have a high BMI and diabetes.
Right. That's a really important point.
Yeah.
There are definitely layers of risk to consider with any surgery,
Yeah,
especially one as involved as this.
for sure. And I think it's also worth mentioning that the NIDDK source found that follow-up interventions are actually pretty common
Oh, interesting.
within the first 5 years after surgery.
Okay.
Yeah, so they said about a third of patients need some kind of follow-up procedure.
Wow.
And they were more common after gastric bypass than after gastric sleeve.
Okay, so it's not always just one surgery and you're done.
Exactly.
Okay.
Which brings us to like a really big topic.
Yes.
The lifestyle changes.
The long term.
Yes.
Mhm.
So what can you tell us about that?
Well, both the Mayo Clinic and our patient education materials, they really stress that having surgery is just the beginning. It's really about making those lifelong changes to your lifestyle.
So it's a tool.
It's a tool.
It's not a magic solution.
Exactly. Yeah, you're going to have to commit to a new way of eating.
Like, what does that look like?
So it often involves working with a registered dietitian
Okay.
to create a personalized plan for you
Yeah.
with specific nutrition guidelines and meal plans.
Since you're eating less. Right.
Right. And your body's absorbing nutrients differently.
Yeah.
So choosing nutrient-rich foods and getting enough protein, vitamins, minerals is like super important.
Got it. So what about exercise?
Yeah, so regular physical activity is another really important piece.
Okay.
The Mayo Clinic really emphasizes finding an exercise plan that you can stick with,
Right.
something that fits your needs, your abilities.
So you don't have to like do something you hate.
Right.
Just something you can do and keep doing.
Exactly. And then there's medical follow-up.
Oh, right.
So regular checkups with your doctor, ongoing support from your dietitian, even mental health screenings.
Mental health screenings. Why is that part of it?
Well, it's a huge life change.
Yeah.
And it's important to have support for any challenges that come up.
Makes sense because it's not just about the physical stuff.
Right, exactly.
Okay, so anything else on the lifestyle changes?
Yeah, the patient education materials. They also mention some other things that are often recommended or required,
Okay.
like quitting smoking,
Oh, right.
limiting alcohol,
Okay.
and avoiding recreational drugs.
So it's really like a whole health overhaul.
Yeah, taking a holistic approach.
Okay. And I think it's also important to like address the mental and emotional piece.
Yeah, for sure.
Like the Mayo Clinic was talking about how important it is to be mentally and emotionally prepared.
Yes, absolutely.
Why is that so important?
Well, as we've been discussing, it is major surgery.
Yeah.
There are potential risks.
Right.
There are complications.
Uh-huh.
Um, But even beyond that, it's a decision that's going to change your life.
Right.
You need to be ready for that.
It's like getting ready for any big change, right? Like, so
Exactly.
you need to have your support system
Yeah.
and be ready for the ups and downs.
Absolutely. And that's where that team of experts comes in.
Right.
They can really help you prepare.
Okay, so what kind of things are we talking about?
Well, if you have a history of eating disorders or unusual eating patterns, that needs to be addressed.
Right, because that could make it hard to be successful after surgery.
Exactly.
Yeah.
And the same goes for depression or anxiety.
Yeah.
If those aren't treated, it can be really hard to cope with the challenges that come with surgery
Right.
and to keep up with those healthy lifestyle changes.
So it's like you're setting yourself up for success.
Right. Building a strong foundation.
Yeah.
And that might involve things like psychotherapy
Okay.
to help you develop coping skills for stress and emotional eating,
Yeah.
and also to address body image concerns.
Okay, so it's really clear this is not just about the physical.
It's not.
It's about like everything.
The mental, the emotional,
Yeah.
all of it.
It's a whole journey.
It is.
Wow, okay, so we've covered a lot.
We have.
The different types of weight loss surgery,
Right.
all the benefits, the risks, the lifestyle changes.
Big one.
Yeah.
Yeah.
It seems like it can be a really amazing option for some people,
Yeah, for the right people.
but it's definitely not something to take lightly.
No, it's a big decision,
Yeah.
but it can be life-changing.
It's amazing how far, like, the science has come.
It really is.
Like, the fact that it can help people lose weight and, like, fix diabetes and heart disease and stuff.
It's pretty incredible.
It's really incredible.
Yeah.
I think it's also, like, really important to highlight that team approach.
Yes, it takes a village.
Yeah, it's not just about the surgeon.
Right.
It's about all the specialists working together.
Exactly. The dietitians, the psychologists,
Yeah.
the nurses.
To give people the best possible outcome.
Yes, holistic care.
Yeah. And it really drives home the point that it's not just about transforming your body.
It's not.
It's also like a mental and emotional transformation.
Absolutely.
Yeah. It's like
Yeah.
tackling the root causes and helping people build healthy habits.
Giving them the power to take control of their health.
Exactly. Okay. So to sum up this first part of our weight loss surgery deep dive,
Okay.
I think we've got a pretty good understanding of like what it's all about.
Yeah, the basics.
We've looked at the types of surgeries, the benefits,
Right.
the risks,
The lifestyle changes.
the lifestyle changes.
All of it.
I hope our listener feels prepared to do some more research and maybe even talk to their doctor if they're thinking about it.
Absolutely.
And as always, we encourage you to do your own research,
Yes.
talk to your doctor,
Yes.
and really weigh those pros and cons before making any decisions.
Absolutely.
But before we move on to the next part,
Okay.
we wanted to leave you with something to think about.
Oh, I love this part. Okay, what is it?
So this wasn't in any of our sources,
Okay.
but we were thinking as weight loss surgery becomes more common,
Right.
what are like the long-term effects on society?
That's a great question.
Yeah, like how it changes healthcare costs and like how we view obesity.
And body image.
Yeah, it's just something to ponder
Yeah, definitely.
as we move forward with this.
Yeah, it makes you think it's not just about the individual.
Totally.
It affects everybody.
It's a ripple effect.
It is.
Yeah, it really does. Okay, so before we like got sidetracked by those bigger questions,
Okay.
we were going to talk about the like mental and emotional part.
The psych stuff.
Yeah.
Yeah.
What are some of the like psychological challenges people might face?
Well, one of the biggest ones is just adjusting to a new body image.
Oh, yeah.
You know, you've lived your whole life with a certain body,
Right.
and then suddenly it changes.
Yeah.
And that can be really tough.
It's like your outside doesn't match your inside.
Exactly. And it can take a while for your mind to catch up.
Uh-huh.
Some people even struggle with body dysmorphia, where they still see themselves as overweight,
Really?
even after losing a lot of weight.
That's got to be so hard.
Yeah, it can be really disorienting.
Yeah.
And then there's the emotional side of things.
Right.
You know, weight loss surgery can bring up all these different feelings,
Yeah.
like excitement, anxiety, fear,
Uh-huh.
even grief.
Grief. Why grief?
Well, some people grieve the loss of their old body,
Oh,
even if they weren't happy with it.
right.
You know, they might miss certain foods,
Yeah.
certain eating habits.
Yeah.
It's process.
It makes sense. Yeah.
Yeah.
You know, it reminds me of something we read in the Mayo Clinic source.
Okay.
They were talking about how important it is to like address any underlying psychological issues before you even have surgery.
Oh, yeah, that's key.
Yeah.
Like if you have an eating disorder or depression or anxiety, those things can really affect how well you do after surgery.
Yeah.
So it's really important to deal with those beforehand.
So you're like setting yourself up for success.
Exactly. Yeah. You're building a strong foundation.
Okay, what are some other like hurdles that people might come across?
Well, social relationships can be tricky.
Oh, interesting.
Some people find that their relationships change after surgery.
How so?
Well, sometimes people get uncomfortable with the attention
Oh,
or even jealousy.
yeah,
That can come with weight loss.
right.
Other people might feel pressured to eat more than they should
Oh, yeah.
or to engage in old habits.
That's gotta be tough.
It can be, yeah.
It's like a whole new world
Right.
socially.
Yeah. And then there's the whole self-sabotage thing.
Self-sabotage.
Yeah, sometimes, even though people consciously want to lose weight and be healthy,
Uh-huh.
they might unconsciously do things that, undermine their progress.
Oh, interesting. Like what?
Things like overeating,
Oh, yeah.
grazing,
Okay.
emotional eating.
Yeah.
It's a way of coping with stress or difficult emotions.
So it's not just about like willpower.
No, it's
Yeah.
much more complex than that.
Yeah.
It's about understanding your patterns
Right.
and developing those healthy coping mechanisms.
So it sounds like having a good support system is key.
Absolutely, yeah.
Yeah.
That's why that multidisciplinary team is so important. They can provide counseling, support groups,
Yeah.
different resources
Yeah.
to help people work through all those challenges.
And like a therapist too, right?
Oh, yeah, for sure.
Who specializes in this.
Absolutely.
Yeah. Okay, so we've talked about the physical stuff, the mental and emotional stuff.
Right.
But there's also the like societal piece of it.
The big picture.
Yeah.
Yeah.
How does society view this?
Right. Because weight loss surgery doesn't exist in a vacuum.
Right.
It's affected by all those societal norms and expectations.
Like we live in a culture that's obsessed with being thin.
We do.
Yeah.
And that puts a lot of pressure on people.
Especially people who struggle with their weight.
Absolutely.
So do you think weight loss surgery is ever seen as like a quick fix?
Oh, for sure.
Yeah.
Yeah, I think there's definitely a risk of people viewing it as a cosmetic solution
Right.
rather than a medical one.
Like they just want to fit in a smaller size.
Exactly.
Yeah.
And that can be dangerous
Yeah.
because it really minimizes how complex obesity is
Right.
and all the serious health risks.
Yeah, it's like we're reducing people down to their bodies.
Exactly.
Yeah.
And we're ignoring all the other factors
Right.
that contribute to weight gain.
The NIDDK was talking about that too.
Right.
Like how important it is to look at those underlying factors.
Absolutely. Yeah. It's not just about shrinking the stomach.
Yeah.
It's about creating a healthier lifestyle overall.
Totally.
And part of that is addressing societal biases
Mm-hmm.
and promoting body positivity.
Yeah, for sure. I think it's also important to acknowledge that like the financial part of it,
Oh, yeah.
weight loss surgery can be really expensive.
It can.
And not everybody can afford it.
Absolutely, yeah. That's a
Mhm.
huge issue.
Yeah.
It creates a system where the people who need it most can't get it.
Right. Because of money.
Right.
That's a real problem.
It is.
Yeah.
And it highlights the need for, policy changes,
Yeah.
greater access to affordable health care
Totally.
for everyone.
Okay, so to wrap up this part of our deep dive,
Okay.
I think it's clear that weight loss surgery is a really complex issue
It is.
with a lot of like layers to it.
Yeah, definitely.
It's not just about individual health.
Right.
It's about all these societal norms and access to health care.
And our own biases.
Yeah,
Yeah,
it's really interesting.
it is.
Okay, so we've talked about a lot in this deep dive.
A lot of information.
We talked about all the different types of surgeries, the benefits,
The risks.
the risks,
The psych stuff.
the psych stuff, the lifestyle
The
changes,
societal
the
implications.
societal stuff.
Yeah.
I feel like I've learned so much.
Me too.
Yeah. But before we bring this deep dive to a close, I wanted to talk about resources.
Oh, yeah. Good idea.
Yeah, for people who want to learn more.
Yes, definitely.
So for starters, the NIDDK website is amazing.
Oh, yeah. They have a ton of info.
They have like everything.
Yeah.
They have really detailed explanations of all the different types of surgeries, the risks, the benefits, even like personal stories from people who've had the surgery.
Oh, that's great.
Yeah, so that's a good one.
Yeah.
I would also recommend checking out the Obesity Action Coalition website.
Oh, yeah. They're a great resource.
They have a ton of stuff too for people who are like affected by obesity.
Yes, they do. Support groups, educational materials.
Yeah, and advocacy initiatives.
They do a lot of good work.
Yeah. And then if you're interested in like the mental health side of things.
Right.
The American Society for Metabolic and Bariatric Surgery.
Very good.
They have a whole section on their website about mental health.
Perfect.
Yeah.
And don't forget your local library.
Oh, yeah, the library.
You can find books and articles there too.
For sure.
Yeah.
Plus, you can always talk to your doctor or a registered dietitian.
Absolutely. They can give you personalized advice.
Yeah.
Answer any questions you have.
Exactly.
Yeah. And I think it's important to remember that everybody's journey is different.
Right.
You know, what works for one person might not work for another.
That's a really good point.
Yeah,
It's about finding what's right for you.
exactly.
Yeah. Okay, so I think we've given our listeners a good, starting point.
I think so.
Yeah.
A solid foundation.
To continue learning about this.
Yeah.
And to make, informed decisions about their own health.
For sure.
So, to all our listeners out there,
Yes.
thank you for joining us on this deep dive.
We appreciate you being here.
We hope you found it, helpful
Informative.
and interesting.
Yeah.
And remember, no matter where you are on your own health journey,
You're not alone.
you're not alone.
There are resources out there to support you
Yes, there are.
every step of the way.
Okay, until next time.
Yes.
Stay curious
Keep learning.
and take care of yourselves.
See you later.
You know, it's pretty amazing how much weight loss surgery has changed over the years.
It really has.
It used to be seen as this last resort,
right.
and now it's a real option for so many people.
Yeah, it's become much more mainstream.
Yeah.
And I think a big part of that is all the research that's been done
Oh, yeah.
to really understand the benefits and the risks.
Totally. We've come a long way from those crazy fad diets.
And the quick fixes that never work.
Yeah, exactly. Now it's all about a more holistic approach.
The whole picture.
Yeah. Thinking about mental health too.
Absolutely. Yeah, that's huge.
It reminds me, when we were talking about all the psychological stuff, this Mayo Clinic said something about having realistic expectations.
Oh, that's so important.
Yeah.
It's not a magic wand. Right. It's a tool.
Right.
But you got to put in the work.
It's like anything else. Yeah.
Exactly.
Yeah.
But sometimes, people think it'll solve all their problems.
Right.
And then they're disappointed when they still have to deal with, the emotional eating.
Yeah, or the body image stuff.
Exactly.
So it's just one part of the journey.
It's a step, not the finish line.
Exactly. But it's cool how it can really give people a fresh start.
Yeah, a new beginning.
On their health.
Totally. And not just weight loss.
Right.
But their whole well-being.
It's inspiring how many people say they feel more confident.
Yeah.
And energetic after surgery.
More energy.
It's like a whole new lease on life.
It can be, yeah. And that can affect everything else.
Yeah.
Relationships, work, even hobbies.
They can actually do the things they want to do.
Exactly. It's amazing to see.
It's pretty cool.
That's what makes this field so great.
Yeah.
Helping people, live their best lives.
Totally. So as we wrap up this weight loss surgery deep dive,
Okay.
I think we can agree it's a pretty complicated topic.
Oh, for sure. There's a lot to it.
Yeah, with all the different angles.
Yeah, there's no easy answer.
Right.
It's about what works for that person.
Yeah, and giving them the support to actually make it work.
Exactly.
I hope our listeners feel ready to do more research.
Me too.
Talk to their doctors.
Yeah, if they're thinking about it,
Yeah.
it's all about being informed.
Exactly. So to everyone listening,
Thanks for joining us.
thanks for joining us for this deep dive.
We hope you learned a lot.
And remember, no matter where you are on your health journey,
You're not alone.
you got this.
There's support out there.
Okay. Until next time.
Hi, everyone.
Stay curious, keep learning, and take care.